Hi everyone, I'm Mabel, Jong. You're watching WHCC TV, coming to you live from Washington, D.C. at the World Healthcare Congress. I'm so pleased now to have our next guest, Greg Everett. We're going to talk about pricing technology. He's president and CEO of Payer Compass. Hi there, Greg. How are you?
Good to meet you.
Good to meet you.
Good to be here.
And first, give me an intro as to what Payer Compass does. You're based out of Plano, Texas.
Just north of Dallas. We are a reimbursement technology company, primarily focused on helping people understand what price is on a transparency basis. Medicare, Medicaid, and commercial pricing application for self-funded payers and government payers.
Okay, and has the process of pricing become more complicated?
Everything in healthcare is complicated, right? And pricing is one of those. So we do 22 states in Medicaid HMOs. For commercial carriers, many of them use either a bundle price or a Medicare reference price in order to price claims around it. So the level of complexity and edits that you need to have really empowers a price for folks that's more competitive for them in terms of what they want to pay for healthcare.
Can you tell me how reference-based pricing works and why self-funded employers should put their trust in it?
Most providers have a charge master that is excessive, right? And so for us, trying to help people understand what an appropriate price could be with it, we have hospital partners that understand that the price of healthcare largely dependent on their services. And so trying to help meet a need where you can meet their profit objective at the same time for self-funded employers afford health care for their employees. People are having to afford $2,000, $3,000, $5,000 deductibles. People can't afford that. And so there has to be a mechanism by which we can all lower prices at the same time empower folks to pay for their health care realistically. $5,000 deductibles is something that most people can't afford. So to do that, you really need to get health care prices in line so people can afford that care.
Well, a general criticism of pricing is that we really don't know what procedures cost.
They don't, and that's part of what we try to do with Payer Compass is help people understand what the prices of healthcare are, right? Either in a bundle price, a knee, a hip, some medical procedure that can be discernible. People don't shop for healthcare on price. People shop for services, right? You're looking for the best quality, or you're talking to folks about the providers in your community that you trust. And then price is secondary because we have third-party payers in the United States. Third-party payers drive reimbursement. So third-party payers don't make it easy for us to shop as consumers like you would for a TV or a refrigerator or anything else. And so we want to help people, buyers of healthcare, most employers, some government programs that like to understand what that price could be and then help them discern, if you will, distribute what that transparent price could be for these different procedures.
How does direct contracting play a role in this?
So what we find is that hospitals want to have direct relationships with employer groups, right? They don't want to be a provider in a network. They want to be able to have a mechanism by which they can determine the population of who they're going to work with. And providers want to be able to have that relationship with an employer group, right? And so for an employer group, they can then have a price that's probably more competitive. It's less broad than a PPO, general PPO would be, but it allows both of them to come together specifically to talk about population health, those members that have conditions that need to be managed more effectively with the employer. The provider's looking for a stable population of folks to take care of and have a reimbursement from. And so it's really a combination of both. Direct contracting really kind of eliminates the need for a typical or broad network, and focus more around what the employer's needs in that local community. Both of them are in the local communities. Healthcare, like politics, is local. And so people want to get connected to their local provider. Employers do. They're hungry for those relationships. Same true with hospitals.
Okay, these conversations aren't new.
No.
People have been grappling with the same
Correct.
issues, it seems, for quite a few years now. What is your view from where you sit and the work you do as to how things are going?
Well, so consumer-directed healthcare really shifted cost from an employer to an employee, right? And the idea was that we were going to somehow get people to be better consumers. People aren't good consumers of healthcare, right? And so you have disruptors in the marketplace now, CVS with the purchase, with the carrier situation there. You have a change in how people are going to consume healthcare. If you can go into Walmart and receive primary care services in the long run, that's going to put pressure on hospitals to be more competitive with their primary care, have more accessibility with excessive care, and that's consumer-driven healthcare is going to look more like that than shifting dollars to an insured and have them be responsible for $5,000 deductible. Just doesn't really work effectively.
Okay, so what's your prediction for what's going to happen in the days to come, or in the years to come, I should say?
There's going to be pressure. So you're going to have an expansion of Medicaid programs across the United States, just like we've had with the Affordable Care Act. That's number one. Two, you have an aging population. We're going to have a higher. There's going to be a pressure to push down the age of Medicare. So how do we pay for it all, right? And so you've got taxes that are going to have to be paid for those kinds of programs. On the self-funded side or employer side, they're going to be looking to compress those prices. So for hospitals, they have to be more competitive to outpatient procedures, capture that population so that they're not going to be in a financial pinch, because government reimbursement's not going up. It's going to go down.
All right, Greg Everett, may I ask how the conference is going so far?
It's going great. It's a terrific Congress. We've been here 2 years in a row. Love it. They've been really hospitable and working with their staff and meetable. Different conference that we go to every year. We like it.
All right, Greg Everett, thanks again.
Thank you.
And thank you for watching. Stay tuned for more content to come.